the true force of Politico, expertly connecting the dots through transatlantic coverage. We'll stay on this global trend in our next session, the Global Health Reset. Can Europe lead the way? It's moderated by our ACE health reporter, Claudia Chiappa. The discussion unpacks Europe's difficult path forward after Donald Trump's drastic cuts to global health and development funding. Please welcome our panel of experts on the stage.
Good afternoon, everyone. My name is Claudia Chiappa. I'm a healthcare reporter here at Politico. And yes, as you've heard, we're going to talk more about global health and the current situation we're in. We've heard this was a great intro from our colleagues in the US. Obviously, it's been a tough year for global health. I think everyone can agree, or a tough couple of years. We know earlier this year, the US dismantled USAID, pulled back from the WHO, other global health initiatives and organizations, including Gavi. And we know already what some of the consequences have been and what they're estimated to be in the next years. The world kind of turned to Europe in this moment, but even here, the situation doesn't maybe look that promising. Some countries in Europe too, including the UK, Germany, France, are among the ones that cut their development assistance for health, and we don't know what other countries are going to do. So this is kind of where we are. This is the current situation. We're here with our panelists to explore more what we're seeing and what maybe some of the solutions could be. So, well, I'm going to present our panelists now. We have Katie Kempf, Chief of Staff of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Erika Gerritsen, Director of Human Development, Migration, Governance, and Peace at the European Commission's Directorate for International Partnership. Daniela Garone, International Medical Coordinator at Doctors Without Borders. And Michael Makanga, Executive Director of Global Health EDCTP3, an European African Partnership to accelerate research and development of health technologies for infectious diseases in sub-Saharan Africa. We've kind of painted a picture that's maybe not the nicest right now, but we want to also obviously explore what the solutions are. But first, I would love to just do a quick round around the panel and ask, Justin, how much trouble is global health right now? Are we at a point where we're approaching no return, or are we seeing a bit of hope and something that can be done? Katie, can I start with you?
Thank you, and it's a real pleasure and honor to be here. My middle name is in fact Hope, so I will take that
great.
as an entry point. And I think, as the last speaker said, there are some lights coming through. I don't think we're at a point of no return. I do think we're at somewhat of a transition point, and at maybe a tipping point in some ways as well. So we are seeing a shift in the landscape, and we are seeing a change in donor dollars coming in, and a big push, and I think a right push, for pathways to self-reliance and country sovereignty. And this has really, I think, for a long time been in our rhetoric, but we haven't necessarily pushed it as we are now. And so while I wouldn't want to be frank, ever say, let's find the silver lining, the opportunities, I think this is catalyzing us to think bigger, think differently, and push maybe harder than we had been in the past, when we had seen much more growth in the global health sector, certainly from external funding. So a point of no return, no, but I think a point of transition. And as we heard in the Accra reset, for example, it's a reset. It's a little bit of a reflection point.
Thank you. Erika?
Yeah, well, thanks a lot. I'm very happy to be here, and good afternoon to everyone. Indeed, I think I fully agree with you. I think it is indeed a point of transition. I just want to acknowledge and recognize indeed the very important role that the US has played so far in the health financing, global health financing, from around 40% of official development assistance to health in the past. I also want to emphasize the very important role that the European Union, as Team Europe, that is the European Commission and the member states, are playing and are still playing in global health financing. And in fact, if you measure it in terms of solidarity and per capita, GDP per capita and compare it, I think we need to acknowledge the European solidarity to global health generally, which is translating into a huge effort from the Europeans in this global health architecture. Moving forward, and indeed the US has made its decisions, is making its decisions, and indeed having this transition, which we are following and monitoring very closely. But it is the same for the European member states. Many member states have also reduced. From our perspective, the president has announced the multi-annual financial framework with an ambitious, renewed ambition generally for the European Union and including for global health. But I also think that talking about transition, we know the importance of health sovereignty, global health sovereignty, but also at country level. And I believe that it is also the moment to really think about this discussion about global health financing and natural sovereign health financing. Maybe we can go into this a little bit further in the next questions, but this question of the financing and the financing model really needs to be put on the table.
Yes, thank you. I think we're hearing so far a lot on, there's a moment of transition. Daniela?
Thank you very much for the question and the panel. I think we will develop further during the... But I think I wanted to start answering your question and stating the obvious. Global health is only global if it's counting the health of all. And that is very important because solidarity is not a matter of goodwill, it's a necessity. And I think it's important and it's simple, paramount to prevent diseases for everyone across borders globally, because diseases doesn't stop at the border between countries. This drastic reduction in donors' fundings at a global level is a problem, but at a local level, at a regional level, is worsening. And we see the impact of this in terms of preparedness, in terms of capacity to ensure access to timely treatment. And that will push only the most fragile health systems to the limit. And we've seen in some of the latest summits affected with the cut of financing that there is a tendency to refocus on health security or refocusing on transferring some of these responsibilities to countries. And I think Global Fund has brought a lot of experience on the challenges to push the co-financing or rely too much into private sectors contributions and the interest of defining medical countermeasures that are accessible and affordable. And that is what is going to challenge us, how good we can coordinate to bring these solutions into the table. It's not enough a pandemic treaty that agree. Now we need to walk. How is that is going to look like in practice? Where is the role of global? Where is the role of the regional medical countermeasures or the stockpiling of R&D, and be in a coordinated way? And I think this is still to be seen, even with an optimistic mindset like mine. We see this impacting catastrophically in the countries that we are working. And there are no actors that could fulfill that situation with a short time in the cuts. Of course, it's pushing us to be better, to coordinate, to avoid duplications. We've been too duplicated, too triplicated after COVID, very chaotic global health implementation. This is an opportunity to reset, but not forgetting where are the needs, and the narrative need to be driven by the patient's needs.
Yeah. Thank you, Daniela. Michael, same questions. Yeah.
Yes, no, thank you. From the global health EDCP 3 perspective, as you know, partnership is really at the core of what we do. And the withdrawal of funding, of the US funding, has, in a sense, re-emphasized the need to strengthen partnerships. And I see this is the time when everyone is looking at the EU to reposition itself, to take leadership. But what I see here is that this is a golden opportunity for the European Union to rally its member states, its partner countries, and other key partners or actors, including those from the private sector, to step up collectively. And when we look at the European Union at the moment, it has a unique position in that it has the credibility, the experience, and the capacity to provide the critical leadership, rallying the partners behind it. And one of the things I want to emphasize here is that when we talk about global health, true leadership in global health is the ability to work equitably with others. And I see that global health leadership here is being emphasized to refocus on partnerships. And when we look at our situation as a program, partnership has been very instrumental. All the successes that we've registered, and I can speak to over 9 products that we've delivered to the people that really need them. These have involved partnership that is involving the European Union, the member states, the private sector, and other funding agencies, in addition to the people that are involved in this. So this is a unique opportunity to refocus our way of working around partnerships.
Thank you. I think we got already a great kind of sneak peek at the themes of hopefully the rest of the discussion, both the transformation, taking this moment as an opportunity, but the fact that we do also need to do something and goodwill is not enough. I will come to you, Katie, again now. So obviously we heard this earlier, the Global Fund has its replenishment, well, it's been ongoing, but it's culminating Friday. So it's very close. We've had already pledges coming in over the past few months. Some of them, I think, have been a bit of a disappointment for the global health sphere. For example, the UK has cut its contribution by 15%. We still don't know what the EU will contribute and what the US will contribute. We heard some positive, perhaps, signs from Carmen, but obviously, I know perhaps you can share what you know, but can you share how you're feeling going into Friday as an organization, and what are kind of your key hopes for remaining partners to donate at this moment to the Global Fund?
Yeah, thank you. So as you said, we do have our replenishment summit on Friday in Johannesburg, South Africa, which is co-hosted by the UK and South Africa for the first time, hosting on the African continent and on the margins of the G20. As you mentioned, we've had funding roll in. This isn't just sort of one moment in time, but we often use it as a marker. And so to date, we've already been able to raise over $4 billion, including more than $1 billion from the private sector, which is the largest we've seen to date. So really looking to diversify where funding comes from, I think, has been an important part of what we're doing. There are still a number of unknowns, as you said, but I think we feel strong in where we're standing right now in terms of the commitment, as you heard, that we have from the US, from the ongoing support we get from Team Europe and member states. And in fact, I recently learned that over 1/3 of our funding has traditionally come from the EU member states. And this is a trend we, of course, would want to see continuing. And we've, in fact, already received a number of pledges from EU member states. So we feel confident in that sense that we have a lot of good signals. Signals aren't money in the bank, and we need to make sure that we're able to convert those pledges into dollars that can be implemented at country level. We are seeing a decrease across many of our partner organizations who've been through replenishment cycles recently, and we know that we are part of that, but we also feel like we are putting out a strong narrative as to why this money is so important and right now. And if we don't continue on the path we've been on, we can reverse decades of progress. And our colleague just mentioned that lenacapavir has rolled out in 2 countries, in Eswatini and Zambia, just 2 days ago. this is a huge, huge potential game changer in the battle against HIV/AIDS. Leaving that now is just such a disservice to all of the fight that we've had over the last 20 years as part of the Global Fund partnership. So I hope Friday goes well. I think we have a lot to be proud of as a partnership going in, and we also have a lot to face in terms of the reality of a changing landscape, and we want to be part of that too.
You've mentioned diversifying funding, for example, now with private partnerships. We're always part of the of your work, but is there something more that you're looking at now with the prospect, let's say, of if you are part of one of the organizations that sees a reduction in the total replenishment funds? What are some ways that you guys are already having conversations about maybe restructuring the way you invest the money if you have less of it?
In terms of private sector or
In
more
general,
broadly?
no,
More
so,
broadly. Yeah, so we have an allocation model, and we, in fact, at our November board meeting, which was held in Malawi, last November board meeting, we re-looked at that model in anticipation of potential lower allocations, sort of seeing a bit the writing on the wall of where some of the ODA, where the trends were going. And so we have pushed further funding into lower income countries with higher disease burden. And that doesn't mean that there aren't very important key populations in other areas that need this funding, but the board made the decision to push the funding there. We also redid our sustainability and transition policy, which has the co-financing as part of it, so looking to strengthen that as we work with countries, particularly in, if we do see lower funding scenarios. So a lot of these, it sounds very bureaucratic, but a lot of these policies have been put into place in order to hopefully account for potential lower scenarios. At the same time, we have to be honest, less money and less grant money going into countries. We can work smarter, we can work better, we can find efficiencies and the triple efficiencies and all that, but there's an impact, right? And if you have less going in, then you're not going to have the same outcomes that we did before.
So a lot still at stake for Friday and the next few days.
Absolutely.
Which leads me to Erica. I don't assume you can share what the EU is planning to do with the Global Fund, but perhaps, well, if you can, what are some ways that, the EU, I think, is in a very, really at the center of the focus right now, the EU and EU member states. There is a lot of responsibility, I think, a lot of calls for leadership. How is this perceived from the EU, and what's your response to that? How can the EU take up that role?
Thank you very much. And indeed, it is true that we see a lot of eyes coming our way. But and I think that the EU and the European Commission in particular is ready to play its role here. We have after COVID we had already adopted the global health strategy, for which we already had the first midterm report, this strategy really aims at learning the lessons from the COVID crisis and identifying where there are gaps in this health sovereignty and health security agenda. And this is where also from our perspective, it's really important to build the autonomy at country level. And the autonomy at country level is built through the manufacturing agenda, which is connected to our Global Gateway strategy, whereby we are fostering and increasing the capacity of private sector investors to produce vaccines or other medical products on the continent, and we are starting having a few successes. It's a long shot, it's a long-term vision, but I think it's a very important one for us to drive together with the African continent. This requires a lot of research as well, and the partnership that we are having with ECDCP, sorry for the acronym, 3, is a very critical one. And all this work that we are doing on research also needs to be then translated into actual investments, production. And ultimately, the vision behind this is also creating growth at country level, and therefore generating the revenues at country level, which will allow the patients, the citizens, to have access themselves to the health services and to the health products that they need for their own health. So I think that behind this vision, behind the Global Gateway, there is really this long-term vision of a partnership to create this long-term growth in our partner countries, while also fostering the global health sovereignty. moving forward, as you probably know, the President of the Commission, Ursula von der Leyen, has announced in the State of the Union address in September the launch of the Global Health Resilience Initiative. And the Global Health Resilience Initiative is again meant at bringing all these dimensions together of what is happening at global level, which is absolutely crucial, essential, and the work that the Global Fund and other global health initiatives are doing is key. So what happens at global level, but what also the very important role of the regional dimension and the country dimension. So it is true that while everybody, like a lot of people are looking towards the EU, but I believe that this is fundamentally a global discussion that we need to have, and that all actors need to be brought together in this partnership, and that we have to commonly come to solutions where we will be able to use grant money or official development assistance in a more effective manner and in a manner that responds better to the actual needs and asks of our partner countries, especially in sub-Saharan Africa, but also in other regions in the world.
Yes, thank you for also bringing up the Global Health Resilience Initiative. Obviously, I think that was seen as quite a positive sign from Ursula von der Leyen. And yesterday we asked, Commissioner Labib was here, and we asked about the initiative, and it did sound like it would really focus on this partnership dimension of it. And this is obviously an important aspect, capacity building in these countries and local and regional manufacturing. But it can't really replace multilateral aid, right? I mean, these are complementary, and we're seeing from the US, there is also, I guess, the question of, okay, but are we already in a position where we're strong enough, where there is enough capacity was built already, where we can pull the funding, and this is having consequences. So maybe if you want to respond to this, but then also like to turn to Daniela on this, how do the two go together? Like how, because we're going to continue to do capacity building, but there has also continuing to be some aid, some donor recipient aid.
Yeah, I think there's no sign, or at least like from our perspective, to move away from the idea that indeed this agenda will require official development assistance and bring in other actors, private actors, maybe other donors, global donors who probably now are in the capacity to contribute to this global initiative. So the idea of the Global Health Resilience Initiative is by no way to sort of move away from this global agenda. But what we want to do, however, here is have a real discussion about the global health architecture today. The system that we have now has been established 20 years ago in a world that was what it was 20 years ago. The world has changed. Surprise, surprise. Needs are different, expectations are different, aspirations are different, and we need to recast this global health architecture in order to not only react to the funding dimension, but also to have an architecture that really responds better to the needs in the world to ensure universal health coverage and access, to ensure that there is a universal social protection systems that allow, again, each citizen to have access to health insurance, social protection, and therefore also to the health services and products. So this is from our perspective, this is the reflection that we need, that we want to have. We have already started this reflection in partnership, really bringing all the actors together around the table. This reflection that we are leading. There is also the Lusaka agenda that is ongoing. There is the Accra process. So there are a lot of pockets of reflections going on, and it's really very interesting to see all this blooming, and hoping that we can land in at the right moment with a new and global vision on how we can be stronger together in the world for the human security, health security, and sovereignty.
Yes, definitely. I think this was also very much a discussion. I was at the World Health Summit in Berlin last month and pretty much really dominated a lot of the discussions there, that this is a moment where we have to recognize perhaps obviously the impact that's very much present, but also how it also exposes some vulnerabilities in the system and how to move forward. Daniela, can I get your input on this? And first off, on what you're seeing, because I think you work with a lot of partners, Doctors Without Borders, where you're really seeing a lot of these impacts that we're talking about and the consequences that they're having. So they're obviously not to be underestimated. But then how do we move forward to a system that is even better than the one that we had before?
Wow.
Sorry, big question. Yeah, I know.
We have only 12 minutes, no?
I know.
Okay. No, I think there is important to have the narrative coordinated on one side, because it's true there is an opportunity to build it, to build partnerships, to create capacity and build resilient systems. But on one side, we think it's great that the EU health strategy mentioned the importance of equitable healthcare, but is focusing a little bit too much into the health system. While in fact, we know that even if you build health systems, there is still a lot of people who will not access the care. So then, if we move in the conversations to focus on the people needs, on the population's needs that are engaging with the population. Example, there are many populations who needed measles vaccination, no COVID vaccination. COVID wasn't a problem in there. It was a problem that the kids were not having during COVID time, access to routine vaccinations. These need to be engaged, the communities where we are targeting. And communities today are not anymore beneficiaries. They need to be treated as stakeholders. And I think Global Fund has a lot to say about that. So in one sense, equitable access, what is meaning is that Ethiopia, Sudan, Ukraine, and Belgium will have the same opportunity to access what they need. But this is important because I'm sitting in the medical countermeasures net and in the stockpile management of vaccines, and now we started managing the Mpox vaccine. And what is meaning the need of mechanisms at a global level that doesn't have an attachment with any region in particular. Yeah, so the stockpiling of medical countermeasures has been on the table, and even I'm sitting in the EU Health Task Force, and we are discussing that. But when you're having a stockpile for vaccines that doesn't exist in a quantity that is needed, then your regional mechanism is in a disadvantage for a global health, because you will need to choose between your own country and a global other country. So the next step into implementing equitable access is to define the role of these global stockpiles versus the regional stockpiles, regardless of the capacities. Because today, if we could diagnose better meningitis, and we don't have a rapid test to diagnose meningitis despite years of working, we would treat earlier meningitis, we would use less antibiotics. So for Europe, it's important the EMR global agenda. Maybe meningitis is not a problem, but it still is a problem because of the morbidities, the meningitis. So then there is where the agendas, the global agenda has to get together. Yes, because there is a lot of transversal, and we were talking with Kate, Global Fund has a lot of transversal health system strengthenings that you needed from HIV, TB, and Ebola, and Mpox. So then there is where the challenge will be to get all of these together, knowing that there are populations that always will be vulnerable and in disadvantage, and any global mechanism should ensure that this population has access to the same opportunities without transferring liability or over demanding contractual negotiations, and to put these in organizations that today are the more affected organizations, NGOs, local NGOs, global programs of USAID cut, programs with the PEPFAR cut, the non-production of some of the HIV tests. These are concrete things. And I think this is in the agenda, needs to be put with concrete actions.
Do you think there is enough ambition right now from countries to do this kind of coordination?
I think we're moving into that, and I think EU could play a key role to bring the leadership into that conversation. There is a lot of discussions that EU and partnerships that has been developed through EDCTP on R&D. It could go a little bit more, maybe, on defining, okay, why not diagnostic on meningitis to be put on the table? I think there are a lot of these contributions that can be leveraged from the leadership of the EU and the contribution, but now need to look at a little bit more global, but also how they collaborate between the countries in Europe. And I think that's the EU has task force is 2 years and is evolving and probably will look at this, what is better, how the collaboration happen between countries. Still is a little bit too much, the pain of the COVID situation is still with us on, what happened? Yeah? And it was simple. There were need of mask and oxygen. And the two were very simple tools to save life. But still there is no a good inaction. Yeah, in paper, I think we're moving. Yeah, but in action, I think we need to go pragmatic.
Yeah. Thank you. Michael, so I wanted to move to you because I think EDCTP is, I think, a good example of doing some of the things that we're talking about where we're helping with health sovereignty already in countries instead of just funding individual projects. So can you tell us a little bit about what's been successful, you think, for the model of the partnership and some ways that you think maybe could be an example of for further investments?
Well, thank you very much indeed. What has been successful in the ADSTP program? First and foremost, it has been the focus of the program. It has been the governance of the program and the way we look at success. And in this case, if I may move one step back, because I don't want to miss this opportunity in the way that at this flexion point, we look at global health and the role of the EU in this. This is a moment when leadership in global health should not be, the EU leadership in global health should not be seen as a charity. It is an opportunity for Europe, scientifically, economically, geopolitically, and financially. Success in global health is measured in millions of lives saved every year, in healthier, more productive individuals and communities, in greater equality and opportunity for women, for marginalized populations, and in stronger and more resilient countries. And this is an exceptional social and economic return on investment. And with this in view, I just want to look at some of the successes that the program has delivered. These have been mainly products that are aimed at addressing major medical needs. For instance, interventions for children. We've contributed to the development of the first 2 malaria vaccines. And when I look at one of the malaria vaccines, and that is R21, the analysis that was done, the investment in this malaria vaccine, it could yield more than 4.5 trillion in global economic returns from the reduced childhood mortality and illness. And yet the investment that has made in this was only 51 million from the EU funding. Secondly, the program has delivered interventions for diseases that barely had interventions, especially the neglected tropical diseases. We had diseases that had very severe ways of diagnosis and treatment that were only dependent on parental treatment and intrathecal removal of cerebrospinal fluid to examine that, to be able to confirm diagnosis and treatment. Now there is oral treatment that is made available. We've contributed to delivery of preschool children formulations of medicines that can be given. More recently, this year, we've contributed to the first Coatem baby product. This is the first malaria treatment in children below 5 kilograms. There wasn't any intervention in that area. And many other interventions that are in the pipeline. But I have to say that when you look at the products in the pipeline, these require long-term investments. And in this case, as leaders in global health, we should not just be looking at the short-term gains and returns. We should be looking at the long-term investments that are going to be sustained. And this is where we've contributed substantially as well in building the expertise that is required to address infectious diseases. And this expertise has been diversified in periods of epidemics, in periods of outbreaks, and even in the pandemics to work on other diseases. We've contributed to building a sustainable clinical trial infrastructure and systems that require multiple players to chip in. But to sustain this will require relooking at the way we measure success in global health. And the other piece I need to say is to re-emphasize the role of partnerships. The way that we work, we are involving the funding that comes from the European Union that leverages funding from the member states. And at the moment, we have 31 African member states and 15 European member states. And these member states have an equal say in the development, in the establishment of the priorities, and in determining the way the funding is spent. And there is also a mechanism to leverage funding from other contributing partners. But this needs to be reinforced so that this can now produce more productive funding, counter-funding that can match the available resources for the long term. Over.
Thank you so much, Michael. I think we have to wrap up. We're at the end. Anyone has any response or last words that they'd like to share?
If I could just pick up on a couple points, but I think the access point is so important. And we can have great innovation, and we see it with lenacapavir, we see it with dual AI bed nets, we see it with AI-generated TB tests, et cetera. But if there is not access and communities aren't involved in civil society, it doesn't help. And so that, I think, is such an important point to take home as we rethink a new global health ecosystem.
I think I would say that in the new model that we all aim to achieve with these resets, the center of power for global health solidarity cannot be an environment where risk compensation and financial gains are the drivers of that decision. I think it's very important to understand the equitable part of access to care, not only to medical countermeasures.
Thank you. Erica?
Yeah, thanks a lot, and a very interesting conversation. I think from our viewpoint, really, I mean, and also taking from this discussion, we are talking here about a supply and demand, and there is a need for a supply that is affordable and that is qualitative, and this is something that we can help generate with with research, with investment, with private sector actors, and with innovative financing. And we also need to generate this demand that will allow for these private sector investments, and this demand needs to be accessible also for all the citizens. And I believe that by building this sustainable demand at country level with universal health coverage, we can really match those in an economic model that really works for everyone.
Great. I think it's a great note to wrap up on. Thank you so much for the great discussion, for your time. Audience, please still stay seated. Deirdre will be with you soon. But thank you.
So